guys to the game that we'll be playing today, which is on the respiratory system. And this game will be consist of 3 levels. Level 1, which is a true and false. Level 2, which will be multiple choices. And level 3, which is mainly discussion and multiple answers of the question. And so you guys will be participating as players in this game. So would you guys like to play as solo players or team members in this game today?
Team.
Team.
Okay, so we'll be playing as team. Since everyone is here, the players will include Emir, Balvin, Divya, and Sabrina, and I will be the host of this game. You guys are clear on that, right? Okay.
Yeah, clear.
So good luck to you all. I hope you guys can answer the questions correctly, and hope you guys will make good choices. So level 1, we will start with the true and false. Question 1. Exhaled air contains more nitrogen than atmospheric air does. Is it a true or false?
I want to answer it. I think it's true.
So do you guys agree? Should you choose true?
Yeah, I'm agree with
Okay.
her.
Then true it is. You guys are correct. Congratulations. So you guys gain 5 points for this question.
Yay.
So on to question number 3. The process of internal respiration is a gas exchange between blood vessels and tissues. Is it true or false?
True.
True, I agree.
True? Are you guys sure? Does everybody agree on that?
True.
Yes, you're confident.
Okay. Quick answer to that one. Confident?
Yes.
Congratulations once again. You guys got it right. You guys get another 5 points. And now you guys have 15 points. So question number 4. Gaseous exchange takes place in the pharynx. Is it true or false?
I think it's false. I agree.
Very quick.
False.
Confident.
False.
That is great. You guys are correct. You guys are very smart. Congrats. So it is false because gas exchange takes place in the alveoli instead of the pharynx. So now we move on to the next question and you guys get another 5 points. So now you guys have a total of 20 points. Congratulations. So question number 5 is what we are on now. Cilia filters keeps the mucus and dirt away from our lungs. Is it true or is it false?
True.
I think it's true. Very quick of Balvin. Confident. That is very good.
True.
So it's true. You guys chose true.
Yes, true.
Yeah. I think that's what considers the pop also.
Great. You guys got it correct once again. Smart bunch. Good. So you guys can unlock to your next level now. We are moving on to level 2, which is a slightly difficult level from level 1.
Yes, we can do this, guys. Let's go.
So are you guys ready for the medium level?
Yes.
Yes.
Be excited for it.
Come on, guys, more energy. We need more energy in this game.
Yes. very
Yes.
good.
Yes.
That's better. Okay, now we will start. So on to question number 1 on level 2. Many respiratory diseases affect pulmonary function by altering the ability of alveoli to participate in gas exchange. What physical change would most greatly reduce the degree to which a particular alveolus is ventilated? So you guys can choose between these 4 answers, and you guys as a team can discuss. And if you are in trouble and need help, you guys can also use a hint. You guys can choose, so it is up to you now. What do you guys think? Is it too difficult for you guys to get the answers?
I think we use our hint for this question.
So you would like to use your hint?
Yes.
Okay. So we'll use the hint. So the hint is ventilation refers to the air reaching a particular area of the lung. Perfusion refers to the blood supply to a particular area of the lung. Though both are important for gas exchange to occur in our body, the question specifically asks only about ventilation. So based on the hint, you guys can think about which of the 4 answers it is referring to.
Can you show us the options again? Okay. I think I will go with D.
Do the rest agree? Will the
Yes.
answer be written as D?
Yes.
I agree with her.
Agree.
Agree with her.
Okay. So we will choose D. It is the correct answer. Congratulations to everyone.
Yes.
Good job, Alvin. Good job, everyone.
Thank you.
You used the hint well. So you guys gain points from that, and now your points are 35 points. On to the next question. So question number 2 of level 2. During inspiration, intrapulmonary pressure is defined as A, greater than atmospheric pressure, B, less than atmospheric pressure, C, less than intrapleural pressure, or D, equal to the interpleural pressure? Which one of those is the definition of intrapulmonary pressure? You guys can discuss. I will give you time for you guys to choose as a team which one do you think is the correct answer.
I'm confused between left and respiratory pressure and left and intrapleural pressure.
DVSH is confused between B and C.
Yeah, I'm confused between that too.
Yeah, I
Between
think
B and C.
yeah.
Yes.
I think I will go with B.
I think I'm going with D.
So Emir chooses B. What does the other think?
I go with B also.
I choose intrapleural pressure.
I think I will go with C also.
So which is the answer, B or C?
Trust me, it's B.
No, you may trust me. You may trust me. It's okay. I mean, we can give it. I mean, at least I think we can give it a shot. So
So, which will be the choice? D or C?
C.
I hear more enthusiasm for B. Will it be B?
B for boy.
B.
I think it's D.
Come on, guys. Majority. Sabrina, you are the final choice. Which one?
Samina, don't feel this.
Okay, now we go for B. Like B. Let's go for B.
B.
Yes.
It will be B.
Okay.
Okay. So you guys will choose this answer. B it is. Let's see if it's the correct one. You guys are indeed correct. Congratulations. Your choices of B were not in vain. I think you guys made the right choice in choosing Emir's choice of B. So the explanation for this question is because the pressure gradient between lungs and atmosphere, it happens when the air moves into and out of the lungs. So intrapulmonary pressure is when it is less than the atmospheric pressure, and inspiration can occur within the lungs when it is less than the atmospheric pressure. So you guys gain yet another point. So you guys are up to 45 points now. Congratulations.
Yay.
So we move on to the next question in level 2. So the respiratory membrane, also called the air-blood barrier, what is it made of? A, squamous cells, basal membranes, endothelial cells, or B, air, connective tissue, lung, or C, squamous and cuboidal epithelial cells and macrophage, or D, pseudostratified epithelium, lamina propria, and capillaries. Which one do you guys think is the answer to this question?
I think A, squamous cells, basal membranes, and endothelial cells.
Yes, I also think A because pulmonary endothelial cells limit the influx of fluid, solutes and macromolecules to the interstitial and alveolar compartments. So yeah.
So you guys chose. So everyone agree on that choice?
Yeah.
Which choice you will be?
Yeah, right.
Yeah.
I
You want to
think
agree on A?
A.
Yes.
A.
Okay. So we will choose A and see if it is the right answer or the wrong answer. You guys are really smart. It is yet again the right answer. Congratulations. You guys gain more points. So now you guys are up to 55. So now we move on to the last level, which is the heart level, level 3. Are you guys ready for level 3?
Ready? Yes, let's go.
Yes.
go.
Yes, let's go.
Let's go, baby.
So,
Kiss.
okay, on to the first question of level 3. You guys better be prepared for this one. What are the correct steps involved in the respiratory system? So you guys, this question have multiple answers. So you guys better think carefully before choosing your answers. And you guys should be discussing for this one. The discussion should be more heated up. And you guys can choose the correct answers after you guys have done your discussion. So I will give you time to discuss now. Go ahead and discuss.
Guys, I think for sure internal respiration and external respiration is included for this answer. Aerobic respiration is used for the cells kind,
Yeah.
right?
Yep.
Yeah.
I think pulmonary
It's
ventilation.
most common. I think aerobic respiration is most common in plants and animals. So for sure that's out of the list.
Yes.
So internal and external and host, we have a question. So is it
Yes.
like 2 to 3 choices or only 2? Please give us a hint.
It is more than one, definitely. The answer.
Is it more than 2?
Is it
Is it more
Pulmonary
than
is the
2?
correct.
This is a heart level, so You guys should be thinking how many steps it would be. Is 2 enough, or is there another answer that might guide you into more steps in the respiratory system?
I think, I mean,
Who knows? Maybe not.
maybe, Amy, you were saying something just now?
Pulmonary ventilation should be the answer. Among the
Yeah,
answer
okay,
lah,
we go
because
for the
pulmonary ventilation is breathing. So yeah, it should be in the answer lah.
Okay, I agree with Amy.
So,
Amy is having luck. So,
guys, that's the discussion that you guys finalize on. Would you
Yes,
like
so
to
we-
put it in order?
Since I tell already, pulmonary ventilation is the breathing. So yeah, I think pulmonary is the first one because that's the flow. We must inhale or exhale first for the respiratory system. Sabrina, you want?
And then for the second one,
Second part, I think external, right? Respiration.
yes, I think it's external too.
so as a
External?
final answer,
And then pulmonary external, then followed by internal. So yes, that's our final answer.
that's your final answer.
Yes, we love.
Okay, everyone agree?
Yes.
Agree.
Agree.
Let's see whether you guys are correct or wrong. You guys are indeed correct. And in the order of it,
Yay.
it is indeed correct. Pulmonary ventilation is first, external respiration is the second, and internal is the third. Congratulations, you guys gained, I think, 15 points from that question. You guys, be confident in yourself. So now, as the ending, this is a surprise round for you guys. I bet you guys are excited, right? Yay!
Yes, can't wait.
So now this is the discussion time, which you guys will be discussing with each other about a case study. And you guys can take your time. There is no definite right or wrong answer that will be shown, but you guys should be able to gain more knowledge on this round, and you guys can determine if your answer will be the correct one or not. So this is the case study that you guys will be discussing together. 20-year-old Sachin came down with symptoms of a common cold. She had runny nose, fatigue, mild cough. After a while, her symptoms started to improve. But recently, her coughs got worse. She coughed up a lot of thick mucus, and her throat is also sore from how frequent she's coughing. Her chest also feels very congested. What do you guys think may cause these symptoms of hers to arise? You guys may start a discussion now. Like I said earlier, there is no definite correct answers to this. There is no you would say the list of answers. So you guys may come up with your own discussions and opinions on why this happens. So you guys can start discussion time now. Go.
In my opinion, I think it's smoking because it's one of the biggest cause that will actually cause our cilia to die off, and the cilia is like the membrane that sweeps off the dust and stuff. So if you're smoking, we're actually ingesting in more harmful particles into our body. So and it can also burn off our cilia, which will cause the mucus in our mucus line to just increase because the particles are increasing in our body, the harmful particles. That's what I think.
What about the others? Divya has given her opinions. Melvin, Emir, Sabrina?
Yes,
Any of you
I
guys have
agree.
the thoughts?
I think I agree with Divya. And as the question said that yet the coughing is getting worse, and one of the symptoms of a smoker can be they're having bad cough.
I think I agree with what Divya said, because all of these are not because at first I thought it was asthma, but is it asthma or smoke?
No, I don't think so. It's related to asthma.
So yeah, I agree with Divya.
So I
Sabrina?
think she
I think,
was
yeah, same. I also agree with Divya because her explanation is detailed and it definitely makes sense seeing the symptoms that they have. One of the common symptoms is for smokers.
You guys may discuss more. Maybe I don't
Can
know
we discuss on the
why
way
this
to prevent it?
happens, how to prevent it, I guess, from getting worse. Anything that you guys consider to be detailed enough for research for this case study.
Okay, so the way that she can prevent it to get worse is obviously to quit smoking. So that's the main thing that she has to do to prevent it. And other than that, she has to take good care of her health, in my opinion. And besides that, she can go through I would say that she can thin the mucus by drinking plenty of fluid, which is like water, so that it can reduce it, or she can stay in a steamy room. So it is also one of the reasons it can thin the mucus. So yeah.
good enough answer, like reasonable answers. Any more points to add, Amir?
She needs to get plenty of rest.
I think I agree with Bhavin and Divya and Sabrina. So
That is if the case if she is a normal smoker. But if she's a chain smoker, I think they cannot just quit smoking. So it's going to take quite a long time for them to like get over this
Yeah,
issue.
agree.
True.
yeah,
I agree with that. It is very hard to suddenly stop a habit that your body is used to, because sudden how do I say, when you suddenly quit it, then your body may react worse to not having that material or that substance in your body. So I do agree, Sabrina. So I guess that can conclude our overall game for today.
Yay. We shows on point.
So in
Our point.
total,
oh
you
God,
guys
so power.
the calculation, you guys actually point 120 points. And that also includes the discussion. So congratulations, guys. You guys were great participants for this game. Engaging. You guys, your guys' discussion was also very good. And as team players, I think you guys do support each other very well. And your knowledge of the respiratory system seemed very detailed. And I think that is all for today. Thank you guys for participating. And I hope you guys have a good day.
Thank you,
Thank
host.
you.
Bye.
Thank you.
Bye, guys.
Nice game. Thank you. Bye.